Hello everyone. So today in this lecture we will discuss about the non-metallic inorganic irritant poisons. Now first we have to discuss about the classification of irritants. Irritants are divided into three classes, that is first is agricultural, second is inorganic and the third is organic. Okay, and now examples of agricultural poisons are organophosphates poison, carbamates, organochlorines. Now inorganic irritants are further divided into three parts. The first are non-metallics and the second is metallic and third is mechanical. And the organic irritants are divided into vegetable and animal parts. So today we will discuss about the non-metallic inorganic irritant poisons. Okay, non-metallic inorganic irritant poisons. The examples are phosphorus, iodine, chlorine, bromine, etc. Now the first is phosphorus. There are two types of phosphorus. The first is white phosphorus and the second is red phosphorus. The color of white phosphorus is white yellow as the name says, and the red phosphorus is reddish or brown. Appearance of white phosphorus is translucent or have waxy cylinders, and it is amorphous or solid mass. Smell and taste is garlicky. It is odorless and tasteless. The red phosphorus is odorless and tasteless. On exposure to air, white phosphorus oxidizes and emits white fumes, and it ignites at 34 degrees centigrade. So it is kept under water. And the red phosphorus is non-oxidized, non-fuming, non-inflammable. The use of white phosphorus are fertilizers, vermin killers, rodenticide, fireworks, gunpowder, that the crackers you see in Diwali. They all contains white phosphorus, and the red phosphorus is used on the side of matchbox. The white phosphorus is highly toxic, but the red phosphorus is non-toxic. The image of white phosphorus is like this. It is kept under water so that it doesn't get fire, and the red phosphorus looks like this. Now you have all seen that. Now we will discuss about the various characteristics of phosphorus poisoning. The first is the fatal dose. Fatal dose of phosphorus is 60 to 120 milligram, roughly 1 milligram to 10 per kilogram. Okay, the fatal period is 2 to 8 days, and the action is protoplasmic poison. It is a protoplasmic poison, that is, it causes cellular oxidation. It works at the cellular level. Okay. The signs and symptoms, it depends on the amount of poison taken. That is, the first is in fulminant poisoning, the second is acute poisoning, and the third is chronic poisoning. So in fulminant poisoning, that is, fulminant means it is a sudden and severe onset. So this poisoning occurs from ingestion of massive dose that is greater than 1 gram. Okay, if the dose is greater than 1 gram, then the signs and symptoms of fulminant poisoning occurs. Death occurs within 12 hours due to shock and cardiovascular collapse, because the phosphorus has direct action on heart and blood vessels. Okay, if the patient survives for more than 12 hours, then he will be deliriant and maniacal before death, and also vomiting, severe nausea and vomiting and retching occurs. Now we will discuss about the second acute poisoning. Okay, it consists of three stages: first stage, second stage, and third stage. Okay, due to local irritation, the first stage, it starts from few minutes to few hours after exposure, and it lasts for 8 hours to 3 days. In this, we have due to local irritation, we have symptoms like nausea, vomiting, thirst, and it causes severe burning pain in throat and abdomen. Okay, the vomit and feces, they are luminescent, which is diagnostic of the first stage of acute poisoning by phosphorus. Okay, and also the breath and feces, they have garlic like odor, and also when there is a skin contact, it causes painful second and third degree burns. Okay, now after that we have a second stage which lasts for 2 to 3 days. Okay, and it is in this stage patients feel fully recovered. He thinks that he doesn't have any disease, and he thinks that he can leave the hospital. It is a symptom free period. Okay, now after that there occurs a third stage in which the poison gets absorbed into the system and causes various systemic disturbances. Okay, multiple organs are involved. like the digestive system, they are presented with increased severity, like increased nausea and vomiting, and also hematomesis. Okay, and also there is hepatic system. System is also involved, like tenderness of liver, enlargement of liver occurs. Okay, pruritus occurs, jaundice occurs in the third stage. And also the renal system is also involved. The renal damage occurs in the form of anuria, oliguria, albuminuria. Okay. Also, the mucosal hemorrhages occurs from the various mucosa sites, and also the in viscera, from the viscera, due to inhibition of blood clotting. And it also causes neurological symptoms. CNS system is also involved, which causes convulsions, delirium, and coma. Death usually occurs due to the shock, renal insufficiency, hepatic failure, or depression of CNS or CNS damage. Okay, so this is the acute poisoning. Now we will discuss about the chronic phosphorus poisoning. In the chronic phosphorus poisoning occurs due to frequent inhalation of fumes of phosphorus or phosphorus pentoxide for a long period of time, which causes a condition called as phossy jaw or glass jaw. Okay, this condition is first characterized by a toothache. Uh, it occurs in the region where there is already a tooth caries, or there is a space and the microorganisms are already present. So the first thing is that occurs is the toothache, which is followed by swelling of jaw and loosening of teeth. Then there occurs necrosis of gums, and there is a sequestration of bone in the mandible. Okay, osteomyelitis and necrosis of lower jaw occurs with evidence of multiple sinuses discharging foul smelling pus. So this is how it looks like. There is the lower jaw has osteomyelitis, but there is a fistula drainage, foul smelling pus. And also this is how the teeth looks in the chronic phosphorus poisoning. You can see the sequestration of mandible, also necrosis of gums are absent, swelling of the jaw is also present. Okay, so this is the picture of chronic phosphorus poisoning, also known as phossy jaw or glass jaw. And the systemic symptoms that are included in the that are present in the chronic phosphorus poisoning includes nausea, vomiting, diarrhea, joint pain, etc. Okay, now we will learn about the treatment part of the phosphorus poisoning. Okay, so the basic treatment is like gastric lavage. It is done by using solution of potassium permanganate in the concentration of 1:5000. So the how it works is it converts phosphorus into harmless phosphoric acid and phosphates. Okay, so this is the first step. The second step is we can do also stomach wash by the use of 0.2% copper sulfate solution. And the mechanism of action of copper sulfate solution is that it coats the particle of phosphorus and forms a compound called copper phosphide, which is harmless. But the copper sulfate has caustic properties, so it must be used with caution because it can cause acute copper poisoning. Okay, the third step is we can give vitamin K, that is 20 mg IV in repeated doses to combat hypoprothrombinemia and repeated blood transfusions. And also IV glucose with vitamins and noradrenalines is given to combat the hepatic damage and to maintain the blood pressure, etc. And also one thing to remember is that oily foods and fats should not be given because it increases phosphorus absorption from the system. Okay, and the basic treatment is as in all general cases of poisoning. So this is the main treatment: potassium permanganate, copper sulfate solution, vitamin K, and IV glucose. Now we will discuss about the post-mortem appearances. Okay, so do you see this changes when the light is turned off? It occurs in phosphorus poisoning. In phosphorus poisoning, there are luminous areas over the skin. So this is a telltale of the phosphorus poisoning. Now the other findings in the postmortem appearances are there is a garlicky smell in the vicinity of the deceased and in the stomach contents also. Okay, and also the jaundice occurs, the hepatic system is involved, the livers become soft, yellow, swollen, fatty, and it is easily ruptured. There is a skin and mucous membrane will look yellow with petechial hemorrhagic spots. There is mucosal hemorrhages and hemorrhages over all the mucosa, in the gastrointestinal mucosa, in the pleura, everywhere, due to clotting disorders caused by phosphorus. And in person who survive for a week or longer, there is appearance of acute yellow atrophy of liver are present. And in fulminant poisoning, there are no obvious changes can be found, but in the esophagus and stomach or esophagus and stomach, there is luminous content may present. Okay, and the stomach contents are also luminous in the case of post-mortem finding. Now we will discuss the second inorganic irritant poison. This is a bluish black crystallic metallic luster with a soft crystals material. So this poison is iodine. Okay, it is a bluish black soft scaly crystals with metallic luster. Okay, it gives violent colored vapor at all temperatures. Okay, so and has a characteristic odor by which it is identified. So it is used in antiseptic preparations. You have all heard about the tincture of iodine, and has a iodide properties, antiseptic properties. It is also a protoplasmic poison like phosphorus, which fixes the proteins and causes necrosis. And the mechanism of action is also the vapors. The vapors causes irritation of the respiratory system. Now the fatal dose of iodine is 2 to 4 gram, and if it is in the form of tincture, then it is 30 to 60 milliliter of the tincture of iodine. Okay, the fatal period is 24 hours. Now the signs and symptoms of the acute poisoning of iodine are like if it is inhaled, the vapors are inhaled, then it causes the respiratory damage by irritation of respiratory system and causes pulmonary edema and glottic edema. And if it is taken as solid like in this form, then it causes it acts as an acute corrosive acid corrosive poison. Okay, it acts as acid corrosive poison. So it causes burning pain from throat to stomach, and intense thirst, feeling of intense thirst, vomiting and purging, etc. Okay, so and the corners of mouth are stained in this color, iodide color, yellowish color. Okay, and when taken as a solid, okay, it causes irritation and nephritic and renal failure. It acts on renal system. The vomitus and the excreta are bluish, yellow to bluish in color. Okay, and as a characteristic iodide smell. The urine is reddish brown in color and which contains albumin. And it also causes iodine induced acute sialadenitis, which is characterized by diffuse enlargement of submandibular and parotid gland. Okay, so these are the symptoms of acute poisoning of iodine. Now we will discuss about the chronic poisoning of iodine. It is also known as iodism. Okay, it causes anorexia, lymphadenopathy, weight loss, metallic taste, stomatitis, conjunctivitis, and many more symptoms like iodine mumps. The main typical symptoms is also skin manifestation of iodine, chronic iodine poisoning called as ioderma. It includes triad of erythema, urticaria, and acne. Okay, now we will discuss about the management of iodine poisoning. The first step is the decontamination. If there is skin exposure, wash with copious amount of water, and also if there is eye exposure to eyes, you have to do the same thing like copious irrigation of eyes by running water. Okay, now we can do gastric lavage to remove the stomach, to remove the poison from the stomach. Gastric lavage in the case of iodine poisoning is done by sodium thiosulfate, that is 5% solution of sodium thiosulfate. It converts the harmful iodine into harmless iodide. The third step is that sodium bicarbonate is given to treat for treatment of metabolic acidosis. Okay, and hemodialysis may be done. Now, the post-mortem findings of chronic iodine poisoning or iodine poisoning are the yellow stains. Yellow stains are present on the clothes if it is in acute cases, and the lips, and they are all stained yellow. Lips and angle of mouth, they are all stained yellow. And the gastric mucosa is also yellowish brown in color. But if there is starch is present in the stomach, then it may appear blue.